Hi there, I'm Mike Umbleby, a licensed pharmacist with over 25 years with Walgreens. Walgreens is committed to championing the health and well-being of every community in America. That's why we're excited to partner with Medicare Made Clear, brought to you by United Healthcare, to talk about Medicare Part D prescription drug coverage. So today we're going to cover the basics of Medicare Part D coverage, how to get it, how to enroll, and some things you might need to know. We'll also talk about some tips and tricks that might be helpful. All right, let's go ahead and get started. So Medicare Part D is Medicare prescription drug coverage. Prescription drugs that are covered vary by plan, but all Medicare Part D plans must meet the same guidelines set by the federal government. The formulary is a list of drugs, includes both brand and generic drugs, and varies from plan as well as provider, but your pharmacist can work with you to determine which drugs are covered or not covered under your specific Part D plan. When Part D plans change a formulary, they may either add or remove prescription drugs from the formulary. Usually the formulary changes on a yearly basis. Your Part D plan will notify you if they change the formulary. Another reason a drug might come off the formulary is if it's removed from the market. Again, your plan will notify you, and you can work with your doctor or pharmacist. Part D plans do not cover all drugs. For example, they do not cover drugs that are not on the formulary, drugs that are already covered under Medicare Part A or Part B, non-prescription drugs, prescription vitamins and minerals, as well as drugs for weight loss, erectile dysfunction, anorexia, hair loss, etc. A formulary also consists of tiers of drugs. Those tiers are usually determined by cost, include both generic and brand name medication. So your doctor or pharmacist can determine which tier and which medication is right for you. The two ways to get prescription drug coverage through Medicare are: one is a standalone Part D plan, or two, as part of a Medicare Advantage plan that also includes prescription drug coverage. It's important to differentiate between the two. A standalone Medicare Part D plan includes prescription drug coverage only. A Medicare Advantage plan with prescription drug coverage is a comprehensive plan that includes Medicare Part A and Part B benefits, prescription drugs, as well as other healthcare services such as hearing, dental, vision, or fitness. So standalone Part D plans can work with Medicare Part A and B, some Medicare supplemental insurance plans, as well as certain Medicare Advantage plans. You can sign up for a standalone Part D plan by purchasing directly from a private insurance provider. This will be separate from enrolling in Medicare Part A or B. You will have a premium and a deductible to pay. You may also have a copay or co-insurance when filling some prescriptions. Here are some important things you need to know for Part D plans. Number one, some plans may offer mail order service. Two, some plans may have a specific network of pharmacies, while others offer nationwide coverage. And three, some plans may require step therapy for certain drugs. So let's talk about when you enroll in Medicare Part D, because when you enroll will determine when your coverage starts. If you enroll before your birthday month, then coverage will begin on the first day of your birthday month. If you enroll after your birthday month, then coverage will start on the first day of the month following the date you enroll. Most people will enroll in Medicare Part D when they first sign up for Medicare during their initial enrollment period. Some people are able to delay enrolling in Medicare Part D because they are working past 65. This group is able to do this because they qualify for a special enrollment period due to having other creditable drug coverage. You may not be taking prescription drugs when you're ready to enroll, but it might be a smart move to get Part D coverage to avoid late enrollment penalties down the line. Medicare Part D coverage is only available through private insurance providers. You will need to sign up for Medicare Part A or Part B separately. And with Part D, the plan you choose will continue automatically each year unless you choose to change plans or your plan provider no longer offers that plan. While costs and prices will vary by plan, when it comes to paying for Part D, you will be responsible for a premium, a deductible, copay, or coinsurance. Some plans charge an annual deductible, but not all do. Deductibles are set amounts you pay out of pocket for covered services before Medicare or your plan begin to pay. Plans may also charge deductibles for certain drugs and not for others. Deductibles can also vary from plan to plan or from one drug tier to another. However, Medicare does set a maximum deductible amount that Part D plans can charge each year. There may be a copayment or copay for a new and refill prescriptions, although some plans may not charge a copay for a prescription. Copays are a fixed amount that you pay for a covered service, and in this case, for a prescription. So now, let's talk about the 4 cost stages of Medicare Part D. The 4 coverage stages are annual deductible, initial coverage, coverage gap, and catastrophic coverage. In the annual deductible stage, you pay for your prescriptions until you reach your plan deductible. If your plan doesn't have an annual deductible, then your coverage starts with the first prescription you fill, and you are now in the initial coverage stage. In the initial coverage stage, you pay a copay or coinsurance, and the plan pays the rest. You stay in this stage until your total drug costs reach the initial coverage's annual limit set by Medicare. Once you reach that limit, you now enter the coverage gap stage, also known as the donut hole. In the coverage gap stage, you pay a bigger share of the costs for your prescriptions than you did before. This means you pay 25% of the cost for both brand name and generic drugs. And you stay in this stage until your total out-of-pocket costs reach the coverage gap stage's annual limit. The limits to enter and exit the coverage gap are set by Medicare, and these amounts can change every year. Catastrophic coverage is the final stage you could go through for prescription drug costs. In this stage, you pay a small copay or coinsurance amount. You will then stay in this stage for the remainder of the plan year. The coverage stage cycle starts over again at the beginning of the plan year, usually January 1st. There is financial assistance available for Part D. For those that qualify, the Extra Help program may cover some or all Medicare Part D costs. Other financial assistance options may be available depending on the state that you live in. This includes state pharmaceutical assistance programs or patient assistance programs. If you are a veteran, you may be eligible for benefits through the VA. So it's important to compare both the VA benefits as well as Medicare to see what you do or do not need, or how the two can work closely together. Here are some tips to help you save money with your Part D plan. Talk to your doctor or pharmacist about any low-cost or generic substitutes to replace expensive medications that you may be taking. Also, think about talking to your pharmacist about a 90-day supply. This costs less per dose than a typical 30-day supply of medication. Also, check with your plan to see if they have a preferred pharmacy network. Copays are usually less when you have them filled at a preferred pharmacy. If you're ready to explore Medicare Part D prescription drug plan options, click on the link, and thank you for watching.